3.
Hi, this is Robert Kraig, Executive Director of Citizen Action of Wisconsin, and I'm out here in Washington, D.C. this week at the biggest healthcare conference of the year, Families USA Health Action 2017, and Kevin Kane, our organizing director, is with me. You can't see him because he's filming this video. So we've been talking to a lot of the top national and state healthcare experts in the country about what's going on with the fight to protect and save the Affordable Care Act and Medicaid and Medicare. And also Kevin and I went up to the Hill, and so we had a very good meeting with Senator Baldwin's legislative assistant, and we spent over an hour, believe it or not, with Senator Ron Johnson's legislative director, and had a very frank exchange and a good discussion. And so I want to report to you how things are going. I'll give you the good news and the bad news. The good news is that all of your resistance and all of the raising your voices, everything people are doing to do actions, talk on social media, to get attention to the consequences of simply repealing the Affordable Care Act without any viable replacement, that it's working. That there is not a consensus among Republicans in the House and in the Senate, that they're definitely feeling the pressure. Their plan in many ways to repeal without a replacement depended on the public not knowing what was going on. But now that they know, now that we focused on it like a laser beam, it's going to be months potentially. We're not out of the woods. We need to keep doing what we're doing, but the fight for ACA and to prevent 30 million people being thrown off health care, 433,000 in Wisconsin, that fight is going much better than we could have imagined 3 months ago, and it's because of Citizen Action members and all of our allies and friends and all of our friends across the country and other states. That's the good news. The bad news is that the threat to Medicaid is real and is going to have terrible consequences. What's being talked about now is fundamentally restructuring Medicaid, either block granting it or creating a per capita cap. And without getting into all of the details about how that would work, these are all mechanisms to dramatically cut the federal role in Medicaid and to get away from the whole concept that it's an entitlement where states get enough money to cover everyone they want to cover, and the state has to, and the federal government has to pay a certain share, and therefore to dramatically reduce federal spending over time. Every other block grant thing, TANF, a lot of other programs, has dramatically decreased in spending over time. And so that's what they're trying to accomplish with Medicaid. The problem is people are mostly focused on the Affordable Care Act and not on Medicaid and don't see what this threat is. It covers 74 million people in the United States. And it's critical health care for low-income people, for children. 45% of children get their health care from Medicaid in the United States, but it's also long-term care for seniors and people with disabilities. So these cuts would be devastating. So what we need to do is both keep up the fight on the Affordable Care Act, but then start to talk about the threat to Medicaid and to realize that if they change the structure, it changes everything. And so I want to commend all of you watching this video for all you've already done, and I want you to join us in continuing activity. We'll be putting out more information, we'll be having more actions starting right away, but we need to keep focusing on a laser beam on the threat to healthcare. And we think if we can get through these threats, that we now have the politics where we can get to affordable healthcare for all. And if you look, there'll be a link to it if you click on this petition. But I recently wrote an op-ed in the Washington Journal-Sentinel that lays out the case and lays out what we think we need to be talking about if we're going to win this fight, and then not only do that, but go to create the kind of healthcare system that everyone in Wisconsin and America deserves. So thank you for all you've already done and all you're going to do. And thank you to Kevin Kane, our organizing director, for taking this video.